react. You whispering my name, thinking I won't be the same. Turn fiction into fact. See what you didn't know, bruises that I'll never show, slipping on your every jab. So tighten up your fist, step into the ring with this. I hope your mama's got your back. First round, you thought you would've knocked me down. Fifth round, bleeding out the side of your mouth. Final round, holding the sound of my name in the crowd. You didn't bust. Oh, 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 oh. You didn't bust. Oh, 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 oh. Just 'cause I took a break, you're making a huge mistake, thinking you can take the throne. Look at you trembling, step into the lion's den. Bet you wish you stayed at home. Begging for mercy underneath your breath when I ain't even sweating yet. My legend's written in the stone, yeah. You're crying age, you're in defeat is now your only friend. Even your mama's gotta know. First round, you thought you would've knocked me down. Fifth round, bleeding out the side of your mouth. Final round, holding the sound of my name in the crowd. You didn't bust. Oh, 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 oh. You didn't bust. Oh, 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 First round, fifth round, final round. Oh, 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 yeah. First round, fifth round, final round. No, 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 no. First round, you thought you would've knocked me down. Fifth round, bleeding out the side of your mouth. Final round, holding the sound of my name in the crowd. You didn't bust. Oh, 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 oh. You didn't bust. Oh, oh,
Hello, hello, and welcome everyone to In Time. I do apologize, my camera is off. I'm going to get that fixed, and it looks like we have an issue with his Xandering's camera. So let's one issue at a time here. And let me get my camera back on. That's just going to take a second. Oh, it looks like... there we are. Okay, so that should... And that's still not going to fix the camera. I do apologize for that. So, Xandering, how are you doing? They can't see us, but you're here. How are you doing, Xandering?
Oh, I'm doing pretty good.
That's good. So, where are you headed to now?
I am in Washington State. I just left Yakima, getting ready to go over Manistash and Untitled Ridges.
You've
We have
basically
some weird names out here.
You have been everywhere in the... I mean, is there any major part of the U.S. you haven't seen? I think you had talked about there was a landmark you haven't seen you wanted to see. I don't think it was Yosemite. I don't remember what it was, but what was it you wanted to see? Was there one?
Well, I mean, there's a few of them I'd still kind of like to see, like the Grand Canyon. I can't drive my truck over to the Grand Canyon and see it, but I would like to go over there.
That's right. They don't let you
I'd like to stop
anywhere
and see.
near that. Yeah.
Yeah, they don't let semis out on those access roads. I'd like to see the biggest ball of twine.
That's a real thing.
Can't really get there. Yeah, it is.
Oh, okay. Well, there you go. All right. Well, so today we are going to be covering COVID updates. What's been going on with COVID? It's been a long time since we've done that for any number of reasons. Not the least of which was, of course, I was out of commission for a little while. I am back. I think most of the fans are happy about that. My wife is still in mourning, but that's all right. Not that she likes me being sick, but she likes it when I can't talk, which is a rarity. Yeah.
You know, if you get her a broken clock, you can just move her into afternoon, and then she'd no longer be in mourning.
Oh, for fuck's sake!
Yeah,
I did the other one. I did. I contacted Maddie earlier, and I told him that the kids had wanted to get another pet, and we said, okay, maybe one pet will go to the store and see. And somebody had brought in a whole box of weevils, a family of weevils, I guess, had been born. And they just brought them in. So each of the girls found one that they really liked, and I said, well, no, we had said one pet, and they said, well, which one do we leave behind? I said, well, you have to choose the lesser of two weevils. Oh, come on. Okay, I didn't even get a high hat for that one. So let's see. So what we're gonna do is let's cover COVID, then we'll bring out Homozygote, which actually I can bring him out right now, and just so you can say hi, and we'll do the quick rundown anyway, because we can't actually do anything about it. No, I don't. For some reason his camera went dark too. This is a bad camera. There it is. Hey there, how are you?
there we go. Doing pretty good. How are you?
Very good. We had a lot of compliments on our show last time you were here. You just had a tremendous amount of information. You related just in an easily digestible manner. So thank you so much for coming back. Really glad to have you back. It's just, wish we didn't need you, to be quite honest. I wish you were unemployed on this front, but you're not. So.
Yeah, I still got my 9 to 5 as a scientist, so you can fire me all you want, and I'll still be okay.
All right. So what has been going on in the last couple of weeks with COVID? Vladimir Putin, the president of Russia, is self-isolating after dozens of his staff and inner circle have tested positive for COVID. The far more contagious variant of COVID, the Delta variant, which is in fact what we had Homozygote on for last time, now makes up 99% of the cases tracked in the United States, according to the CDC. Meanwhile, a number of lions and tigers at the Smithsonian National Zoo and Biology Institute in Washington, D.C. have tested positive for COVID. They now join a number of gorillas at the Atlanta and San Diego zoos, which have tested positive since the outbreak began. Alaska's largest hospital is now in crisis mode, with emergency room patients waiting for hours in their vehicles before even beginning the triage process. Idaho has experienced a wave of COVID patients and have now 40% more COVID patients than their previous peak in the pandemic. Having declared a crisis standard of care for all hospitals in the northern part of the state, they have now switched to the crisis standard of care statewide. This allows hospitals to ration treatment, move patients with lower chances of survival to palliative care, and to go into a statewide state of triage. David Jepson, the director of the Idaho Department of Health, has said that they no longer have enough resources to adequately treat all patients, any patients from COVID to heart attack victims to car accident victims. In other words, they're rationing health care. Currently, they have insufficient equipment, insufficient beds, insufficient rooms, and are preparing for a shortage of ventilators and a shortage of oxygen. COVID patients, which would normally be admitted, are being sent home with prescriptions for oxygen and instructions for their care providers. St. Luke's healthcare system is reporting that they are out of hospital beds and are now treating patients on stretchers. Chris Roth, the president and chief executive of St. Luke's, said, quote, "We will consume every bed and every single resource we have with the COVID patients in our hospitals alone." Last month, 20% of the hospitals in this country reported their ICUs at 95% capacity or higher. 20%, that's 1/5. This month, it is now up to 25%. A quarter of all the hospitals in this country report their ICUs at capacity of at 95% capacity or higher. In a grim milestone in the 201-year history of Alabama as a state, their death rate has exceeded their birth rate, meaning that the state is shrinking. It's getting smaller. This did not happen to them during World War I, nor World War II, nor during the 1918 flu pandemic. Indeed, in 2019, there were 5 states in which the death rate exceeded the birth rate. As of last year, half the states in this country have a mortality rate higher than the birth rate. And we do have that sound again in the background. I suspect that's Homozygoat again. I can... I'll look into it. I don't know if it's the fan or a push-to-talk maybe. There you go. Much better. Thank you so much. Oh, it's back.
Sure.
It's improved, though. Significantly improved. So, Florida has exceeded 52,000 deaths from COVID, or 110% of the total U.S. combat deaths in Vietnam. More people died in Florida from COVID than the total number of U.S. combat deaths. Laura Loomer, an outspoken anti-vaxxer and candidate for Congress in the 2020 elections. She's been banned from Uber, banned from most mainstream social media networks. She cannot get a Lyft either, and is prohibited. She's been banned from. She's been banned for promulgating misinformation and blatant Islamophobia rhetoric. Yeah. And has repeatedly denied the severity of COVID, saying, quote, "I hope I get COVID just so I can prove to people I've had bouts of food poisoning that are more serious and life-threatening than a hyped-up virus. Have you ever eaten bad fajitas? That will kill you faster than COVID." On Friday, September 17th, she announced she had COVID. She said that she felt, quote, "like I've been hit by a bus," and wrote, quote, "I can't even begin to explain how brutal the body aches and nausea that come with COVID are. I'm just in so much pain. Just pray for me, please." Prayer is nice. Vaccines work better. She has been on a cocktail of medications, including hydroxychloroquine, which she demanded. She has also demanded ivermectin. I'm not even sure I'm pronouncing that correctly.
Ivermectin.
Ivermectin, thank you. I have no doubt we'll be discussing that one. And she wrote,
yes.
Yeah, she wrote, quote, "I couldn't get it. Doctors are really weird about prescribing it, which pisses me off," which makes a lot of sense to me because she obviously knows more about this kind of thing than a doctor with no less than 10 years of intense medical training. Governor Tate Reeves of Mississippi declared President Biden's vaccine mandates, quote, "terrifying. This is still America," he wrote. "And we will still believe in freedom, and we still believe in freedom from tyrants." Mississippi, by the way, has some of the strictest vaccine mandates in the country, requiring children to not only be vaccinated against measles, mumps, rubella, diphtheria, tetanus, polio, hepatitis B, rubella, and chickenpox, but is one of a very small handful of states that actually do not allow for religious exemptions from those vaccinations. Alabama is, in fact, one of the other states that does not permit religious exemptions against those vaccinations. The Pfizer vaccine Pfizer has a new protocol which has been reported to be effective in children ages 5 through 11. The dose is 1/3 of the adult dosage, and it is reported not only safe, but successfully triggers a COVID immune response as strong as that for teenagers and young adults. Pfizer says they will apply for emergency authorization for use of the vaccine by the end of the month and anticipate public availability of the vaccine at the earliest by the end of next month. Meanwhile, 2 of Governor Gavin Newsom's children have tested positive for COVID. Both were below the ages of 12, and every other member of his family has been vaccinated. And that is roughly, ladies and gentlemen, what the last couple of weeks have brought. So, Homozygoat, welcome to the show. What are your thoughts on that? Did I miss anything big that I should have mentioned?
Well, I certainly have no shortage of thoughts. I think that's a blessing and a curse, unfortunately. But I think one of the biggest milestones, you might have mentioned it and I might have missed it, But I think we just surpassed the amount of deaths in the 1918 flu pandemic. So we've now, I think, set a country record for most deaths in a pandemic ever. And to me, that's just mind-boggling. The fact that all of this was preventable, or I should say the lion's share of it was preventable, and we, as Americans, and those of us that are in charge, all elected to do the opposite of prevention. We were basically on Team COVID for a variety of reasons, and it's resulted in these unfortunately sky-high case counts and death toll, respectively. So we're in a state that I never thought we'd be in. Like, reality is so wild that you couldn't make this up. Like, how people kind of joke that we live in a simulation, I think we're unironically in a simulation by somebody like who hates science and just wants to see us all suffer. It's crazy. It's crazy. I have no words.
I think that's an important milestone, and for many reasons. And the New York Times mentioned that it was amazing that, considering how much technology has progressed in over 100 years, and we still can't seem to get a hold of it. The only reason I didn't mention it is because, of course, there's a far greater population in the U.S. now, too. So I figured someone's going to give us a hard time with, well, you can't compare the two, which is fair, but it's still an important, I mean, it's still worth, we knew then how to stop this kind of thing. We knew then how to do it. And they had the same argument. So what was it? I think it was in Colorado. I want to say it was Denver. They decided to do, because it's sort of like, excuse me, we, presumably the greatest country in the world, are prepared to sacrifice for saving the planet, right? Going to war, we've changed the nature of the U.S. economy in 3 to 4 months, completely revamped everything, and beat what was at the time the most powerful military ever conceived on the planet. And now we're facing something far more dangerous that's killing far more people, killing far more of us.
Yeah, the alleged invisible enemy. And I mean, it's interesting you bring up, wartime, right? That's kind of the big metaphor, the big argument that a lot of people in charge make. Like, we all need to band together in solidarity with our fellow Americans and combat this invisible enemy that we know exists. Like, now we have the technology to, see it with an electron microscope, to actually understand its biology, its structure, the things that it does in our bodies, and how we can understand all of that and stop it. And the vaccine being a wonderful tool to do that, right? We, back in 1918, had none of that. I think there was still a time where they didn't even realize a virus was causing the flu pandemic in 1918. So if you just compare back then and now, right, we have so many more advantages than we did back then. But I think a lot of the same obstacles are still in our way. Like, even back then, there was still opposition to masks, not to the same extent that we see today. There was opposition, like you said, to lockdown policies, to distancing policies. I think it really speaks to how deep I think this cultural sickness runs, right? We're talking about an actual pandemic illness, but I think there's a greater sort of brain worm, for lack of a better way to phrase it, that we just collectively have as a country, and we can't seem to shake it. It's been a little over 100 years, and it's still here. So, science can only do so much, and I think we really have to come to terms with who we are as a country, and if we don't like what we see, then we need to do a lot of work to change it.
So, I think I completely agree, and I'm misinformation. We did a show also on a post-truth world, and it's very, truth doesn't seem to carry this way. So, Jason Bourne, $1.99 US super chat. This channel is dead. Sorry, Nick, give it up. Well, listen. My favorite hobby is taking horses, killing them, and then beating them. There's no point in beating a live horse, in my view. So, but thank you very much for your super chat. So, let's see. Let's see. We covered the and then I don't know. I wanted to get into the Howard Stern thing, but tell us about the new vaccine protocol for children.
Yeah, so I think, like you mentioned, this was Pfizer releasing their first trial data for children age 5 to 11. Again, as you mentioned, the dose that they are using in these kids is a third of the dose. So for the science nerds, it's a 10 microgram dose compared to the 30 microgram dose in adults. The good news is that it does seem to elicit a very strong response in terms of antibodies. I'm not sure. I don't think the actual preprint publication is out on the preprint servers yet, so I don't know if they actually measured T cell responses as well, which is another big component of the immune system that's relevant when we talk about COVID. It's actually more difficult to measure than simply taking blood and looking at antibodies, but separate conversation. But generally speaking, at least with antibodies, like that's a really good sign. I think the most important consideration is that they did not see any safety signals with the amount of kids enrolled in their clinical trial that they did. Now, the qualifier here is that if we take the kids out of the equation for just a moment, for the adults, all of the eligible folks right now with Pfizer, one of the side effects that is known about is myocarditis or myopericarditis, two kind of similar but still somewhat distinct medical terms. Basically refers to inflammation of the heart muscle and the heart lining respectively. Now, the incidence of those side effects in adults is pretty low. I think we're talking maybe a couple hundred cases, and there seems to be a predisposition towards young males, young adult males in particular, I think up to the age of 30. There are a couple different, I think, age ranges that do have varying numbers with respect to how common the side effect is. With the new data from Pfizer for 5 to 11-year-olds, there were too few kids enrolled in this trial to get a proper estimate of how rare that side effect may or may not be. So I think the big qualifier with this new news from Pfizer, which for the most part is good, is that until the vaccine actually starts rolling out to kids age 5 to 11, we don't really have that great of a picture of how frequent this rare side effect might be in kids in that age range. And I think that might, of course, contribute to some vaccine hesitancy, especially from parents, of course. They're in a situation where they're making the decisions, and I don't think the ages of 5 to 11 have sufficient agency to go and request vaccinations from their physicians, their pediatricians, without their parents' input. So I think this might be a situation where, we'll definitely see some kids in that age range get vaccinated, which is good. Like, as many people as we can get vaccinated, that's what we want. But that side effect in particular, I think, is going to be a pretty big sticking point for the hesitant and the anti-vaxxers. And to me, that's a little surprising, because the overwhelming majority of people who get it get over it, right? Sometimes every once in a while they get hospitalized, which is even more rare, right? Even getting a side effect, first of all, is rare in and of itself, but getting hospitalized because of it is even rarer. And I think there's only a small handful of people, I think you could count them on one hand, that wound up dying from that. I think, if I remember correctly, the number was like 2. So, especially if we're kind of going down in age with kids, we kind of expect them to be in better shape. They don't have as many comorbidities, any medical conditions, because they're only so old, right? They're 5 to 11. So the odds are in their favor, even if they do develop the side effect, that they're probably going to get over it with some time, and they'll be okay. Right? People also don't realize that just getting sick with any virus can cause myocarditis, right? It's probably more common with most viruses, and it's definitely more common with COVID itself. So another situation where, again, the benefits of the vaccines outweigh the risks with respect to this particular side effect. So that's kind of my overview of where it stands right now. When the vaccine rollout for that age range begins, once the FDA gives Pfizer an emergency use authorization for kids age 5 to 11, assuming there's nothing else that the FDA spots, I think we'll get a better idea of how common that side effect is, but you'll also see the anti-vaxxers scream about how we're killing the children. So just kind of be prepared for that.
So we've seen a huge increase in the number of children who are getting COVID now. Is the Delta variant affecting them in any different way, or is this just because back to school, or any thoughts as to why that's happening?
I think it's a little column A, a little column B. I think definitely for most kids, even the eligible kids from age 12 to 18, if we just want to extend it all the way to 18, I think the last time I checked, and hopefully these numbers have gone up since last I checked, but I remember seeing a statistic that said 52% of all eligible kids in that age range were vaccinated with at least one dose, which, of course, it's better than zero, but you would like to see that number getting higher than that, especially if we as a society make the decisions to reopen schools with no remote learning options. That is a situation where we are essentially throwing our kids to the proverbial wolves, the small molecular viral wolves, and letting the virus have their way with them. And there's been an absolute deluge of stories about kids coming down with COVID, and they live, right. The common anti-vaxxer argument is 99% survival. The kids are going to be just fine. Send them back to school. But on the back end of that, they live, but they have long COVID, or they have multi-system inflammatory syndrome in children, or MIS-C for short, right? We don't really have a great picture of truly how much COVID can affect children, even if they live, right? It kind of goes back to something I might have mentioned last time we talked with. We don't really understand how common long it is, who's more at risk, what we can do about it. There's still a lot of unknowns, and I think society erred in sending kids back to school, especially at the mercy of their governors and of their school districts, where some schools have mask mandates, some schools don't, some schools have vaccine mandates, some schools don't. It's a really disturbing patchwork that is coming apart, I think, largely in the South, with respect to how safe the kids may or may not be when they go back to school. So that's, I think, the larger contributor. Delta still, it's a beast. It's a beast of a virus. The original virus itself, I think, was kind of a beast, but this is something else entirely, where we talk about the mutations it has in its genetic code, how people are transmitting greater viral loads, how Delta can cause a greater frequency of breakthrough cases than we all really expected. Delta has abilities that other variants of the virus didn't, and I don't think we really took that into account when making the decisions with respect to opening up schools again. So.
Well, and the other problem, of course, too, is that the more it's allowed to go, even if the mortality rate isn't high enough to scare anyone, the greater the chance that we're going to create yet another variant that is more deadly. Is that correct?
Precisely. Yeah. The more the virus can spread, the greater the opportunity for it to randomly mutate. That's basically what Fauci's been saying throughout the pandemic. The more cases, the more spread, the greater the chance for the mutation, and it could just wind up picking up something that made it even more awful than what it already is right now. Now, interestingly enough, kind of on that note, some of the variants on the horizon don't actually seem worse than Delta, which is something I don't think I thought I would say. That's kind of a light at the end of the tunnel, so to speak. Really, the big thing is if another variant comes through that's more transmissible than Delta, that's where we're going to be in trouble. Transmissibility seems to be the defining criteria upon what variant is going to be the dominant variant in any given place. If it's more transmissible than Delta, then we'll see it pop up. If not, then right now we're not really seeing that. So we're kind of in a time where we might actually have an opportunity, I think probably for the second time this year, to try and get things under control. And I was reading an article shortly before coming on that had some takes from a scientist that kind of suggested this is a distinct possibility that we could actually see cases go down into the winter, which, if it happens, that's awesome, right? We typically don't expect that. We kind of view things through the lens of seasonal flu, and kind of expect when you go into the winter, cases go up, everybody's inside, everybody's transmitting the virus around. But if we have enough immunity between vaccines and all the people who've already gotten sick, we might actually reduce cases. But that's all, I think, a function of vaccination from now until then.
That would be a pleasant surprise.
Yes.
$5 super chat from the Sinister Porpoise. This is actually going back one on the topic there, talking about the 1918 flu. She said we also have one major disadvantage today in fighting COVID over that time, which was that we have the greatest tool ever invented for quickly spreading misinformation, which is a problem I've constantly underestimated, and I've had it explained to me more than once, and I'm really only starting to wrap my head around it, how Google really works to feed you what you want to hear, and not because it's an information really for giving you the news that you need or the news that's most appropriate, but the news that's most likely to get you to click forward so they can get ad revenue and so on and so forth. And that includes parsing what you say so to give you a response that you actually elicited towards whatever biases you already have that were inherent in the question, the way you asked it. So something she knows a great deal more about than I do. I don't know if you wanted to chime in there. So I see you nodding your head.
Yeah, I mean, it's the old, show you what you want to see, so you stay on the platform and look at more ads. It's a unfortunately symbiotic relationship that the internet and the purveyors of said internet have with its users these days. So hopefully one day we can kind of change how that works.
I say that about Twitter all the time. People think I'm kidding. It is a nuanced killing machine, but beyond that, it's that way by design. That's not something that is an accident. They calculated the maximum number of characters that you can have, where you can say the most and yet be understood the least, because people are more likely to engage by hate tweeting than they are by loving whatever you say. It's really easy to put in a heart, but if somebody gets triggered, then they a lot more tweets and oh dear Lord. It's
a carnival.
All right. So speaking of, now this is, let me find the Howard Stern thing, because this is part of the carnival does exist on both sides, and I find it interesting because I'm sort of reaching my limit of tolerance and patience as I see people, because my whole family is vaccinated except for one child who is below the age, and so. It's sort of like we have to act as if none of us are vaccinated, because any one of us could get it and give it to her. So the fact that we're vaccinated actually does, on one front, very, very little good. It's just we still have to act as if we can get it at any minute. If we do, at least we'll be safe. But so that's the first thing. But even Biden said that our patience is wearing thin with the people who are opposing the mask mandates, and I do think. One problem is, by doing this piecemeal, he's giving people who would oppose it a chance to gear up, the lawyers, and gear up to fight this, as opposed to just going all out for a mask mandate. So we'll see where he goes with that. But Howard Stern came out and said, when are we going to stop putting up with these idiots in this country who and just say it's mandatory to get vaccinated? Fuck them, fuck their freedom. I want my freedom to live. I want to get out of the house already. I want to go next door and play chess. I want to take some pictures. This is bullshit. You have a heart attack or any kind of problem, you can't even get into the ER, and I'm really of the mind to say, look, if you didn't get vaccinated and you got COVID, you don't go to a hospital. And then finally added, you had the cure and you wouldn't take it. Now, the only reason this triggered something in me is because I was thinking back to when we were discussing, quote, socialized medicine and the idea that you have a right to healthcare, which we actually already acknowledge, because ERs cannot turn you away just because you can't pay for it. But the reality is, many of the states that are having the worst problems with this are states that sit there and say, you don't have a right to medicine. You don't have a right to see a primary care for you. You have to pay for these things. And, we can't, it would be rationing to let anybody who needs to see a doctor see one, I guess. But there are people who now have taken care of themselves, have gotten vaccinated, do everything they can. They end up in a car accident. They end up in a hospital that's overrun by COVID patients who all refused to take the vaccine. And because they chose not to get it, that person is at risk. Or somebody can't get the vaccine because they're allergic to it or any number of other reasons. And they're counting on herd immunity, which, again, these people are putting other people's lives at risk. So this is now there was I just spoke about Laura Loomer, who people are sitting there saying they hope she dies. And there was he wasn't a selectman. I forget what he was. He was in California. He was the youngest. I think he was 17 or 18. He was one of the youngest people ever elected to a city office. And he was a strong advocate against masks, strong anti-vaxxer. He got COVID, and he said people were wishing they'd run out of ventilators for him. So there is a tremendous amount of resentment from the other side, too. What are your thoughts on this?
Whew, yeah, there's certainly a lot to unpack there. I think I'll start by saying, again, I think as I was saying in the pre-show, I might disappoint some people with this take. But, even for anti-vaxxers, my worldview prescribes that I think we should try and preserve as much human life as possible. Again, the vaccine is a wonderful tool to do that. right? As Howard Stern said, we have a very wonderful way to keep people out of the hospital and alive. That's really one of the biggest benefits of the vaccine right now. It protects overwhelmingly against hospitalization and death, even across all the vaccine technologies, whether you want to talk about Pfizer, Moderna, Johnson & Johnson, AstraZeneca, even some of the other vaccines being used around the world that we don't really talk about much here in the West, have a sufficient amount of protection in that respect to, again, keep people alive. So science has given everybody a pretty powerful tool to do just that. So when it comes down to refusal, I think there are a couple of things that we could have done as a society that we have elected really not to do. At the very beginning of the pandemic, the logic behind locking down the country was to prevent the hospitals from being overrun. And for some reason, seemingly, we, or at least the people in charge, decided that one lockdown was enough and we don't need any more. And right now what we're seeing, you mentioned the state of Idaho, for example, is rationing care and triaging to the best of their ability because of people who are unvaccinated taking up all of the beds in the hospital. That could have been avoided if we were back in lockdown mode. And I know that's something that people probably don't want to hear. The first lockdown, I think, was rough on people, but if you look at a country like New Zealand, for example, even though, of course, they're geographically isolated, they don't have the amount of people in the U.S. that we do. They take, I should say, COVID so seriously that they will lock down the entire country for a single case, because that means that person got it from somewhere else. We don't know if that somewhere else is in the country, and that person could have given it to somebody else and started a whole new chain of transmission. So, I don't know how realistic a lockdown to that extent would be in the United States, but we're taking the do-nothing approach and reaping none of the benefits and all of the misery that comes with it. So I really think if we were morally consistent about why we locked down the country in the first place, we should have kept doing it to limit the spread while we get people vaccinated. And that goes to, I think, the second half of my take is, I really wanted to see vaccine mandates in the form of a vaccine passport, akin to how the country of Israel is doing it now, and akin to, I think, how the UK is doing it in some respects. I don't think they're doing it for every possible venue a person could go to during the pandemic. But what I would like to see is all non-essential services, so restaurants, bars, gyms, concerts. I would like to see vaccine passports be required. I think schools as well, considering the nature of schools and both K-12 and higher ed, right? People are congregating in small rooms, many of which are not well ventilated, which I know from experience, unfortunately. So, we could have taken, I think, those two measures. We could be having this discussion about, Biden's new mandate with respect to OSHA. We could have been having this conversation months ago. And I think right when people got eligible, I think the end of April, I think the day was April 19th, where Biden said, oh, everybody's eligible for a vaccine now. If you're an adult, come and get it. That, I think, should have been coupled with, okay, when summer starts, if we get to June or July, right, to give people enough time to get fully vaccinated, we're going to start rolling out the vaccine passport requirement. So you better get your vaccine. You better reconcile your current beliefs, your current thoughts with the notion of participating in society again. I think we really needed to, rip that Band-Aid off because, like you said, we're kind of just like deciding we're going to rip off the first half and then deciding it hurts too much and kind of putting it back on, not realizing that we got to rip the Band-Aid off to close the gaping wound that we're trying to cover with said Band-Aid. And we got to actually put some stitches in there to get things back under control. So again, I as much as anti-vaxxers are winning Herman Cain Awards, as they're called, named after former GOP presidential candidate and Trump's people are denying the vaccine, they're making fun of science and scientists, they're being virulently anti-science, and then a lot of them just wind up sick with COVID and dying, which again is the notion of the Herman Cain Award, because that's what happened to Herman Cain. And I think either his family or his colleagues were tweeting from his Twitter account being anti-vaccine while he was dead. So that just was a morbid cherry on top of the COVID Sunday there. So again, if anti-vaxxers are racking it up, there's only so much you can do to stop them, but I think we could do more to stop them. I think my worldview wants to preserve human life, even if said human life doesn't have views that I really find all that great.
Or necessarily that much self-preservation. Xandring, what are your thoughts?
Yeah. I think that this is an incredibly difficult situation. because on one hand, you are balancing things like individual rights. And on the other hand, we're talking about, the lives of people, and sometimes the lives of innocent people, not just people who decide, I don't want to, if somebody gets COVID and they have decided, I'm not getting the vaccine, I'm going to be anti-vax or whatever, and they get the vaccine and die, I don't have any sympathy for somebody like that. You made a choice. There are risks involved in that choice, and, those risks overtook you. The thing that gets to me is when somebody decides, makes that personal choice for themselves and then infects somebody else who, for some reason, can't get vaccinated, and then they die. So that part bugs me. It makes it very difficult. And on the one hand, when it comes to the federal government starting to mandate things nationwide, the Constitution does not afford the government the authority to do a lot of the things that a lot of people are asking it to do. And if you want it to have that authority, then you're going to need to amend the Constitution. I'm absolutely not in favor of allowing the government to decide to put emergency practices in place because of a crisis that violate the Constitution. That should never be done, because once the crisis is ostensibly over, those emergency powers don't go away. They remain. So if you want the government to be able to mandate health issues, such as a nationwide mask mandate in public, then you need to amend the Constitution, and if there's enough support for that from the people, then that should be done. I have problems because some of the things that we do, or that we've done in response to COVID, it's like we've gone half measures and gotten the worst of everything. It's like they wanted to shut down the economy. Shutting down the economy isn't without its own risks and without its own costs, including costs of life. The violent crime rate has increased, the suicide rate has increased, and these are also people who are dying. It's very easy to quantify the number of people who have died from COVID. I wish the CDC would be a little bit more clear with its numbers and with its wording about, died with or died from COVID. I mean, we need to be very precise about the numbers, because without accurate information, we can't make accurate decisions moving forward. And it's very hard to quantify the number of people that have died because of things such as locking down most of the economy for most of last year. I know that we're still seeing, I am employed in the transportation sector, and you can still see ripples of damage to the economy that have been caused by this. There's massive shortages in lots of places. A stupid anecdote is I hit a coyote on the road. It broke my bumper on the front of my truck. Part of it's fallen off. I need a new bumper. I can't get one because they don't have any more. They haven't been made. The factories have been shut down for the last year. It's 14 to 18 weeks before they can try and even get any orders in. And it's a bumper. You used to be able to walk into the dang truck shop and pick up a new bumper if you broke yours. There's many things throughout. I mean, just in trucking, it's like we have 4 trucks parked on the parked, can't be moved because they need components for the emission systems. Those factories haven't been open for the last year. They don't have any. There's such a backlog that they're talking about 6 to 8 months before they can get any of these parts to fix these trucks, and in the meantime, the trucks can't be driven. They're just sitting there. There's a lot of examples of shortages throughout the supply chain. So it's not nothing to shut down an economy. It causes quite a lot of damage, and we really need to think and decide as a country what it is that we need to do and what approach would cause the least amount of damage. Life is full of risks, and you aren't getting out of it alive. So we need to find out what's going to cause the least amount of damage, and we're not even attempting that. We're going through half measures. It's like you're either going to shut the economy down, you're going to shut things down, and you're going to try and control a pandemic, or you're not. this halfway mark means that we're not only getting a lot of economic damage, but we're still getting a whole lot of spread of the virus. We're still getting a lot of infection rates. We're getting a lot of people dying from the virus. We're giving a lot of opportunity for lots of different variants to come in. So we're not making any part of any of this any better. I think it's great that we were able to get a vaccine as quickly as we did, especially considering I believe this is the very first vaccine ever produced for a COVID virus, or for a SARS virus. We've never had one before, so this is amazing. Yeah, so this is amazing that we've able to come up with a virus for a. Yeah, well, and the first vaccine for a SARS virus, period. It's the first one. So, there's a lot of cool things going on science-wise, and it's disturbing that people are trying to mounting campaigns of disinformation to specifically cast doubt upon these things. And some of the crazy, wild things that I have heard people, online say about what this virus or what this vaccine is actually for is mind-boggling. And the fact that some of these, wacky theories are even being entertained is kind of disturbing. And I'm not entirely sure if it's, our population has always been this way, and you just never really got to hear about the really crazy ideas that are out there. And now that we have the internet and those people can kind of come together and share their ideas, that we're now being exposed to some of these, frankly, bat-snot crazy people. I don't know if the people themselves are crazy, but they have some serious lack of critical thinking skills and have been indoctrinated into some pretty atrocious belief systems. Or if this is a new thing that's begun spreading, I don't know. Well, we're not doing well, and we seem to be getting the short end of every stick because we can't make up our minds on exactly what it is we're going to do about it.
Yeah.
At this point, COVID has pretty much become endemic most everywhere. I'm not even sure if we can classify it as a pandemic anymore. It's everywhere, and it is going to, you're not going to eliminate it. It's going to be here forever. It's now a new virus like the influenza. So we need to figure out how we're going to handle it in a better manner than we are now.
Yeah, well, I definitely, I think we could probably agree on that. I think that the state of continuous half measures is not doing us any favors. I think, again, going back to something you just mentioned too, with respect to, some of the costs, the economic costs that come with measures such as lockdowns. While, of course, we don't want to actively destroy the economy. I don't think anybody in public health wakes up every morning and drinks their morning coffee and says, "Today I'd take down the economy." We realize
that's Republicans actually make the claim that is what Joe Biden does, and they've been making the claim that Joe Biden hates America, he wants to destroy America. And it's and it works. Their base listens to this, and this. It's just oh dear Lord. Sorry, I just had to because it's wow.
No, you're fine. You're right. That belief is unfortunately, I think, promulgated a little too much alongside the virus itself. But look, with public health measures, we acknowledge that there's an economic cost, and I use the country of New Zealand, I think, as a reference because they have this essentially system where they have on again, off again lockdowns for small amounts of cases, and there have been multiple times over the pandemic where New Zealand and Australia, which is in the midst of Delta outbreak right now. Even their best public health measures couldn't contain Delta because it's just such a beast. But both of those countries at one point in the pandemic were at zero COVID. And I think New Zealand kind of oscillates between zero COVID and a little bit of COVID, mainly because of their lockdown, masking, and distancing strategies, right? Their vaccine rollout has actually been, unfortunately, rather slow. So that actually goes to show you the power of non-pharmaceutical interventions and how we in this country should have, I think, again, in my opinion, really employed them to a greater degree at the start to reduce the amount of community spread that has been seeded and continuing all throughout COVID that allowed variants of our own to arise. And then we didn't have travel restrictions in place. So, we wound up getting the Delta variant from somewhere, don't really know where. But, we allowed people to travel freely in and out of our country and bring the virus to us. And ultimately, if the argument is we had one lockdown and we need to go back and rescue the economy without actually getting the virus under control, that creates the half-measure situation where in some respects we're acting to control the spread, in other respects we're acting to get the economy kickstarted again, and in some cases those measures are in direct opposition with each other. And that's, I think, what's resulted in this current situation that we're in, where nothing really seems to be getting under control. The economy, the economic recovery isn't where we'd like to see it. We decided to remove unemployment benefits, strangely, and open everything back up to try and get people back to work. And like you said, we still have a labor shortage. We're not seeing consumer spending rise. We're seeing people not wanting to take jobs where COVID is still very much an occupational hazard, where they could go get exposed and get sick even if they're vaccinated. There's still the possibility of vaccinated people getting sick and either getting long COVID or dying, but of course the chances are smaller. In the middle of a pandemic, we still obviously want to try and keep ourselves safe and keep those around us safe, especially if we have family members who are not eligible right now for vaccination. So, again, like you said, it's a trade-off between, do we control the virus? Do we act to save the economy and just kind of let people get sick? Do we do a mix of the two? And we've chosen a mix of the two, and I don't think it's worked very well. I really think we could have banded together truly at the start of the pandemic and locked down and implemented a system similar to New Zealand's, where we have transient, local, focused lockdowns in areas where we detect COVID to try and get people to be contact traced, quarantined, and stop chains of transmission. And we have really good scientific technology, such as wastewater surveillance, for example. We can literally test people's poop in the sewers to see where viruses, where the virus is spreading. We can look in certain neighborhoods, towns, cities, by testing the sewer contents for the presence of the virus, and actually kind of get a really good indication of hotspots of where the virus is spreading, and then target public health interventions there. I mean, I think there's a litany of possibilities, and I think in the name of the economy, we've chosen not to use a fair amount of them. One more thing, I'll go ahead and give you guys a chance to talk, but you did mention endemicity. I did just want to touch on that a little bit. I think at this point, the criteria for when we switch from pandemic illness to endemic illness is a little bit unclear. Endemic, again, a term referring to just the virus is kind of always with us. It's always spreading to some degree. Scientists definitely, I think, acknowledge that COVID is going to become endemic if it hasn't already. It's going to be a seasonal respiratory virus that's going to be with us for a while. We'll probably need vaccines and boosters for some indeterminate period of time until we get an idea of how long, over periods of years on end, immunity from vaccines actually last, and whether or not we get any new variants in the meantime. But case counts, at least in the U.S., we're peaking, at least when I checked today, over 200,000. So that definitely is above what I think the CDC considers the sort of endemic pandemic baseline, and definitely qualifies as a pandemic illness in their eyes. So it sounds like, at least according to surveillance at the CDC, we haven't gotten to endemicity yet, but it seems like an inevitability with as much as the virus is spread everywhere, like you said.
For all intents and purposes.
Yeah. I mean, and I because I tried to find what actually makes classifies as something as endemic, or whether it's a continued pandemic, and it wasn't particularly clear, other than an endemic is something that simply lives among the population. It's there. It's a permanent fixture, much like influenza, much like rhinovirus. And it's I don't see any other outcome for COVID other than them becoming that. And I agree. We can't make up our minds on what to do, and it shows in that we get the least of everything. One of the few times that I've always questioned the efficacy of a universal basic income, and wondered, tried to wrap my head around exactly how that could work and be sustainable and do all the things that it claims that it will do. But when we made the decision to spend money on COVID relief, the way they went about it as well, I think, has been absolutely disastrous. I don't understand why or how they made the decisions that they made. And of course, it's politicians, so they're pulling and plucking, and they're looking for their own advantages and not necessarily the best interests of the people in general. But once they decided to spend the money, one of the most effective ways to have spent it would have been a UBI for people. I think we could have been a little bit more successful in doing some of the shutdowns of the economy without as much damage, because people would have still had the money to pay their bills. It's like just simply putting a rent moratorium or an eviction moratorium out, for example, or a utilities moratorium. They can't shut utilities off. That doesn't solve any of the problems. We've got this looming wave of evictions and foreclosures and people who are going to lose their utilities who have been swamped by a wave that they're never going to be able to repay, because they didn't have the money to pay it in the first place. Well, great, during the past year you can't shut your utilities off, but like in Washington, the end of this month that moratorium goes away. What of all those people who couldn't make all of their bills through time now suddenly can't, they couldn't pay a $300 bill? What makes them going to be able to pay a $3,000 bill? Especially after the last year of not working.
All the back, yeah,
because all those charges are still there. They're still owed. I mean, it just seems like we have chosen the absolute worst road in every possible instance through this entire thing. And I think it's a classic example of, or a good case example of what not to do. And I'm not sure where we could have, exactly where we could have done better, because it's like I don't think that, like healthcare official or healthcare workers or that sector or the scientists that are working on this or any of that, I don't think that they're thinking, oh, well, we're just trying to destroy the economy. Those specific sectors need to look at the impacts and what can be done to minimize those impacts, and they need to communicate together. It's like you need to have, because there's costs across this whole thing, and so we need to figure out what those costs are, the best way to mitigate those costs while implementing the most effective solutions that we possibly can, and being able to talk to each other to come up with ideas for what can be done. Economists could have possibly given quite a few ideas on what could have minimized damage to the economy with shutting most everything down, with the ideas, coupled with the ideas of the scientists and the healthcare industry about what kinds of things would be effective at stopping. I'm not seeing all of these people get together and actually come up with a cohesive plan of attack of what could be done to minimize the damage in all areas, and look at some places and say, okay, the healthcare industry wants us to do X, Y, or Z. And if we do it, we can save this many, propose of this many lives. And the economist comes up and says, yeah, but unfortunately, if you do that, you're going to completely collapse this sector of the economy, and the potential damage that could cause is going to far outweigh, the increased number of people who get this on this end. I don't see that back and forth. Maybe it's taking place, but I certainly don't see any areas where it actually is, and I don't think any of the policies that we've come up with or that have been implemented reflect that kind of cooperation has been done to come up with a good cohesive strategy for how do you handle a pandemic that isn't literally just killing everybody outright, but is still dangerous enough that it's killing a lot of people.
Well, let me just real quick. So we've got a super chat, Jake4D. Vaccine passports are hard to sell. On top of that, we already have people selling genuine vaccinated cards to get around this. We also had the 3 troopers in Vermont, I believe it was. Vermont being the highest vaccinated state. 3 state troopers were caught selling fake vaccine cards. So I think that goes to what do we have that's going to work. So please, your response, and if you want to include any discussion on that plan and the vaccine passports and or the cards. But yes.
Yeah, so I'll address the super chat first, and I did also just kind of want to continue the discussion that me and Ms. Andring were having, because I think that's actually an opportunity to talk about a couple of important aspects of our response and the state of our public health that I don't think really get talked about enough. But with respect to the super chat, most people actually don't really know this, but the United States actually made an attempt to create a one database centralized vaccine administration tracking system, where there was just simply one database where all the pharmacists, all the medical clinics could send information about Joe Schmo got their vaccine at this Walgreens on this day and got their first dose and their second dose. All that information could have been stored in a central database. However, unfortunately, our agencies decided to contract out to a private consulting firm known as Deloitte to actually carry out that task. And said private consulting firm did such a shoddy job in creating said system that all 50 states abandoned it very early on in the vaccine rollout. So that situation, at least in my mind, created this gap, right? This inability to track who got their vaccine and when to serve as the foundation for a vaccine passport system, right? As it stands right now, we kind of have a patchwork that is made up of these awkwardly shaped CDC cards that don't fit in everybody's wallet that you can't laminate because we're going to need boosters. Like, again, going back to what Sandring said, it's one of the worst possible decisions we could have made in that respect, right? We subcontracted out, to a private company who did a terrible job because all they were really caring about was government contract money, and we collectively as a country were worse off for it. We have now an inability to fully track who's gotten a vaccine when, and use that information to our advantage to make public spaces safe. So I think if we had a greater ability to keep track of that, I think people would feel more comfortable with the notion of a passport simply because they would know that A, the spaces they're entering in public are safe, and B, that they're not going to get turned away because something like a cell phone app is going to be functioning as intended because it's pulling information from a database that actually exists. So I understand how a passport is going to be kind of a hard sell, but I think at the same time, people, once they realize that they could sort of have this return to normalcy where they could start, participating, spending money, getting back to some of the things that they did, they'd be more willing to agree to such a policy because it means some degree of a return to normalcy. So I think with respect to the notion that a lot of our scientists, physicians, public health officials, and politicians aren't having sufficient discussions to sort of come up with the best plan of attack to stop the pandemic. I think in some respects, I understand why there's that perception. And I think, again, to some extent, there's truth in that. I don't necessarily disagree. We have things like the coronavirus response task forces that were formed under both administrations that were comprised of physicians like Fauci, other public health officials across both Trump and Biden's administrations, some folks from academia too. I think the current CDC director was a former public health official, I think in her position at Harvard, if I remember correctly. So, and in some respects that was happening, and I know we would have had a much greater capacity to have those conversations if Trump didn't, throw the pandemic playbook in the trash that Obama had made for him, made for any future president that came after him. I think there was some degree of foresight, especially with respect to the swine flu pandemic that we had during the Obama administration, to where, we might get caught with our pants down if something worse than this comes along, and we should have some degree of preparedness for it. A lot of those stipulations would have come in handy right now, and I think a lot of the people that were essentially, brought on board to the government that were supposed to sort of fulfill these roles got the can because Trump decided that either it was wasteful or he didn't want it, or I'm not really entirely sure what the logic was there. So with respect to current times, my interpretation of all of these sort of events as the pandemic has played out is that political decision making has seemed to dominate the day. At the end of the day, Fauci doesn't have any political power. He can't issue a lockdown. He can't get the CDC director to issue a lockdown. The scientists and the public health officials are simply there in an advisory capacity. The most powerful scientist in the world right now actually just got a cabinet position in Biden's administration for the first time. His name is Eric Lander, and there are some actual stipulations in some of the relief bills and everything that I can tell will push for by a scientist. But to me, that's the first time a scientist has actually had such a profound influence on how government policy is enacted. Right, they're just kind of in the room to be, the nerds with the black frame glasses and the pocket protectors who sit meekly in the back and provide some information and hope that some of it gets through. So I think I would turn you to look at a country like Canada for, I think, how a more ideal response would be carried out. Their political parties, which again, they're under a parliamentary system, so they have basically a coalition government, and as of yesterday's election, I think they still have a coalition government, not much really changed. But essentially, the Liberal Party and the New Democratic Party, so basically you can kind of roughly think of it as Democrats and Socialists, they have a coalition government in Canada, and they worked together and agreed on a policy where every Canadian got $2,000 a month through a significant portion of the pandemic, and in exchange for that, they stayed home. That was a policy where people were kept whole. They had enough money to pay their rent, pay their bills, to where they didn't have this massive backlog of financial obligations that were piling up that is just going to swiftly kick them in the butt. They're going to get evicted because they didn't pay rent. They're behind on utilities. They're getting them shut off. People were actually the focus. They were the center of the policy. And that is something we easily could have done in the States, and we technically did it 3 times. We had 3 separate stimulus checks, $600, $1,200, and I think another $800 one. The math on the last 2 is a little funky. No, it was $1,400, $600, $600.
At $5 trillion though, at $5 trillion, which is now I think we've hit $5 trillion on what we spent. For $5 trillion, you could get a UBI of I think it's 1,200. It may just be 1,000 for every American for a year. Every American, $1,000. It's not a lot, but it if you're not able to earn an income, if you're stuck at home, so it's $1,000. That's $5 trillion, but that doesn't include the money you get back, because that money is still contributing to GDP, because they end up spending that money. It goes right back into the economy, so it ends up being closer to $2 trillion. And we've spent $5 trillion. So for $5 trillion, we should have had a UBI easily for 2 or even 3 years if we had chosen to, and I think that would have been far more effective. But because of what I consider to be propaganda against socialism, and then the propaganda against scientists, against science, propaganda against, and it's, oh dear Lord, it's. Anyways, I'm sorry, I think I cut you off. I just wanted to hit the UBI numbers while you.
No, you're fine. I think you bring up a good point that you can frame a political policy as a public health tool, like a $2,000 a month check, or the U.S. equivalent, because Canadian money is higher than ours. That was an effective public health tool. It got people to stay home. It reduced transmission, and it helped them minimize the damage to their economy. And I think as a consequence, they felt taken care of. Their vaccination rates are much higher than ours for various reasons, and I think their recovery, both medically and economically, is going to be much more robust than ours.
Yeah, I mean, as skeptical as I am of UBI just in generalized use, we had already decided we were going to spend this money, so that's another discussion. But once you've decided to spend the money, let's find the most efficient way to have done that. And a UBI seems, from all I can see, would have been by far more efficient than what we actually did. I mean, great, you got a $600 check, then you got a $1,200 check, 3-4 months later, whatever it was. That's not paying your rent. That's not buying you any groceries. It's not really helping you much. I mean, it's better than nothing. I mean, of course, but it's not going to be there to. And the fact that once you got it, you didn't know if you were getting another one, so it's not like you could make plans around that. So. It was a horrible way to do it. And there was one thing that you mentioned that I wanted to agree with you very much on. It's my vaccine card. Why in the hell is it this size?
I know.
It does not. It's like I got to fold it. It doesn't fit in my. What am I supposed to do with this? Why could they have not made? Here, let me. Why would it have been so difficult to have made it this size? I mean, that isn't that big of a difference.
It really
irritates
not.
me.
No, something.
And it's a stupid thing to be irritated about, but
it's not,
still,
because you have to carry that. And if we're going to do the any kind of vaccine passport, which I think we're going to have to do at some point in some way, if we're going to get control of this, judging by how we've handled this so far, we're going to wait until it's past the last possible moment where it could actually be useful before we do it. But once we do it, you're going to need these cards. They're not going to be able, because there are no records, they're not going to be able to, unless they want to transcribe those cards to something else, but that makes it 10 times easier to forge. So, you're going to be stuck with these cards, and everybody knew you were going to be stuck with these cards for a while. That's why they made the cards, and they don't fit in anybody's wallet.
Yeah, again, we didn't need a card if we had a central system. Let the computers do the work for us. And we have cell phones, we have apps. That's basically the vaccine passport in Israel. It's just a phone app. Right? You get a little green light, you pull up your app, and you flash your phone, and you're good. We could have had that. We wouldn't have had to fuss with these unwieldy paper cards.
Yeah, and the idea that they can be forged is, I mean, that's not a new idea. I mean, back when the pandemic first started, the movie Songbird came out. And it was about obviously COVID-23. But one of the primary things in that stupid thing were they had immunity passports, and it was a bracelet they had to put on that was coded to you. Yet one of the things in the movie was there was a criminal enterprise selling these things, black market selling these things.
Oh yeah, and having a central system would have easily counteracted forgeries, because there would be a centralized database where you'd have to authenticate, with respect to like a phone app. Your phone app would pull from something like that if you had an internet connection. It could connect to the database, pull the information, you'd be verified and you'd be set. And that'd be much harder to counterfeit, which would I would ensure that the public spaces people are going into are safe. It would engender a lot of confidence in the public health response. But right now, yeah, there are 3 police officers in my state got arrested for coming up with a scheme to forge the cards. It's crazy.
Yeah, and there was something I was just going to say, and I don't remember what it was now. Why do I have such a faulty brain?
Mine's just getting worse. Mine's getting worse. Well, if you remember it, hit me up. I bring it up. I do want to say too, because we've been talking about misinformation. Last time you came here, you were particularly troubled with the CDC and their inability to stay out of the politics and to not act as a political organization. Has that changed or improved any? Have they? You would hope or suspect that everybody always asked Jon Stewart when he was doing the Daily Show, oh, well, now that the Democrats are in office, are you going to you're going to have no one to make fun of? He's like, no, they both suck. It's like because it ain't going to be a problem. So now everyone says with the Democrat in the office, the CDC is going to be a well-oiled machine. Have there been any improvements? Has it really been better? Are there still issues? Are there different issues? What's going on with the CDC?
Yeah, so I think like the first set of criticisms I really levied at Biden CDC, because I'll just say Trump CDC was literally run by a Chinese bioweapon COVID lab leak conspiracy theorist and Robert Redfield. So that's probably one of the worst possible people you would want in charge of the pandemic response in any capacity. But once Biden and folks took power, I think I had a little bit more confidence that at least the vaccine rollout would proceed in a decent fashion. I think my criticisms with respect to the current CDC administration is the fact that they seem to kowtow to political desires more often. I think this is actually something I talk about a lot on my stream. Scientists need to have an actual understanding of politics to be able to navigate conversations and interactions with political actors, especially on such a high stage when you're talking with the literal leader of the alleged free world, President of the United States, and cabinet members and other White House officials. You need to be well versed in having those conversations and asserting the role of science and scientific fact in those discussions to make sure that what needs to get done with respect to controlling the virus needs to get done. Now, I will say, just kind of going into it, even prior to Biden, prior to Trump, prior to Obama, the CDC has been historically underfunded. It has not had the financial expenditures that it has needed to function at its best. The money that it does actually get, in some cases, they do misappropriate it. And there's a general culture, across all administrations in the CDC that's very sort of cliquey and academic, where people within the CDC don't really talk to each other. A lot of the working groups there are just kind of concerned about their little corner of science and nothing else. And the CDC also a lot of the time treats the emergent situation that COVID is. And the Biden CDC especially is, I think, guilty of this. They treat this like they're in academia again, where they can just kind of hang around, wait for data to come in, and you can make the data all pristine and get all the I's dotted and T's crossed, and you can kind of present it like you're submitting a paper for publication. When in reality, we don't have the time or the ability to move at the normal, cruise liner, iceberg, monolithic speed that the institutions of science and medicine normally move at. Like, we need to make decisions here and now. We need to get as much information as possible to make those decisions, and hopefully use said information to hopefully improve the welfare of people. Again, I think the biggest sign, I think this is probably going back to our conversation last time, for me, the biggest sign that they were listening to politicians and letting political decisions rule the day is when they said a fully vaccinated person doesn't need to wear a mask, and we can kind of just start reopening things and getting back to how things were, because that fundamentally was an anti-science take. Because by that point in the pandemic, we knew that masks are a very effective non-pharmaceutical intervention. They have strategic value. They're still hanging around. My school has a mask mandate right now. Many schools still have mask mandates. And places of employment do. Masks haven't gone anywhere, and they're not going to. So why would we not use this tool effectively? And that came back to bite them in the butt, because we found out with the Provincetown, Massachusetts outbreak that vaccinated people can still spread the virus, but they're spreading less infectious virus overall. But that was still a very profound piece of knowledge that we got the hard way, because the CDC made a politically expedient decision to try and, as Joe Biden said, declare our independence from the virus on July 4th. And that was a giant mistake. I think they still haven't learned their lesson in that respect, because another mistake they made back then when they made that same decision was they elected not to keep track of how common breakthrough cases were. They were deliberately not counting mild to moderate, non-hospitalization breakthrough cases basically as breakthrough cases. And all 50 states followed the CDC's recommendation to do that. And that painted, unfortunately, an overly rosy picture in the eyes of everybody as to how effective the vaccines were going to be. Enter Delta stage left, and we get a situation where breakthrough cases are suddenly way more common than we've been told. People feel like they've been lied to. People feel like the situation was not accurately described to them by all the people in charge. And right now, that's Fauci and that's Democrats. And again, we're kind of paying a price for that now, because our vaccination rates are not where we would like them to be, and we're currently in the peak of a massive surge, and the death toll just keeps going up as a consequence. There's one more. There's one more thing that I'm actually just blanking on with respect to the CDC.
Well, they said that, I thought you were going to bring up the map thing, where they had said basically you only need to put on a mask if you are in the red area on the map, and that was the natural. That was the natural. I think the sequelae of the fully vaxxed equals no mask, because that was their very technocratic policy. Is wake up in the morning, assess your own risk for infection. That's actually kind of a meme in my Twitch chat, because Rochelle Walensky thinks every single person has access to the complete entirety of scientific data to make a decision like that. She basically said, look at all the data every day when you wake up with your morning coffee. Take a look at the transmission map of the U.S., and if your county is in the red, where there's high transmission, then put on a mask. Nobody's going to do that. That was an incredibly out of touch technocratic decision that somebody who's spent her entire career in academia or in corporate structures definitely would have recommended people to make. I think it was a decision that was devoid of any information as to how people react and how people interpret the things that you're asking them to do. Okay, I finally remember what I wanted to say. Right now, I think as proof in the pudding that we, or at least our CDC, Biden CDC especially, did not learn their lesson, is the fact that a lot of the data we have right now to make decisions on whether or not we need boosters is not coming from the U.S., right? A country that has vaccinated the most people by number compared to any other country on the planet, the country that also has the most COVID cases on the planet, right? We, scientifically speaking, have more data than anybody else anywhere in the world. And we have allocated the bare minimum, if any, amount of resources to gathering that data and analyzing those pieces of information to have a more informed decision as to whether or not the populace or certain demographics of the populace need a booster. And we are basing those decisions off of data we get from the country of Israel, because they got a priority shipment from Pfizer at the very beginning of the vaccine rollout. So their vaccine administration cycle started sooner than ours. So we're basically having to prognosticate in an Israeli crystal ball, basically, to figure out what the situation is for whether or not vaccine immunity wanes over time and wanes in the face of Delta. And we're using another country's data for that. And we, unfortunately, lack the, institutional fortitude in the CDC to actually do science, hire scientists, and gather the amount of data that we need. I think that goes back to what I said before about the CDC being critically underfunded. But even then, even in the face of said budget disparity, they're not doing very much. And this has actually drawn the ire of many scientists online. A very prominent cardiologist by the name of Eric Topol in particular rants and raves about this
all the time. And he's right. He's absolutely right. It's a disgrace, scientifically speaking, for people who are career scientists who have been in science for decades to essentially decide that they don't want to do their jobs and collect data. And I think that's a political decision at the end of the day. They're content to just tell people to go get a vaccine. Economy's open, go get a job. Corporations need employees. There's a labor shortage. When in reality, that ruins the trust that people put in those institutions, where they feel safe in getting a vaccine, where they feel like it's going to work, where they feel like they can re-enter the workforce and not get sick with the occupational hazard that is COVID.
Well, one of the things that I find, scary about that too is, who are we supposed, if there's a more dangerous virus that comes along and there's another pandemic for something else, who are we supposed to look to get reliable answers? Because the CDC certainly isn't giving us reliable answers, and they don't seem to give a crap about it. They definitely appear to be politicized, and I don't think they're doing a very good job. And that's an institution that needs to have an impeccable, non-political, non-partisan, very scientific-based opinion in the general population, so that when the CDC comes out and says, okay, we've got a serious virus here and we need to do some serious things, people take them seriously. And right now I don't think people are taking the CDC very seriously, and it could really screw us. Which brings me to the other thing that I remembered that I wanted to talk about. COVID-19 ended up being in that sweet spot of places where it can do some significant damage, but it isn't doing enough damage to scare enough people for them to change their behaviors. So we've got the worst of both worlds. It's just serious enough that it's serious, but it's not serious enough to motivate people to change, most people to truly change their behavior. When you see, I guarantee that if COVID had a mortality rate, 10% higher, instead of, killing 0.2% of everybody collectively that gets it, or whatever it's sitting at the moment. I don't recall exactly.
1 and 2%, depending on the country.
Okay, 1 or 2%.
Yeah.
So now imagine if it was killing. Yeah, imagine if it was killing, 10 to 15% of the people, and that's still fairly low percentages. But that would terrify everyone about getting this, and they would absolutely, you wouldn't see vaccine hesitancy. You got something that might make this, survivable? Absolutely, give it to me. But it's right on that cusp where, it can do some serious damage, but most people aren't particularly afraid of it, so they don't, they're not serious. There's a lot of pushback and different policies that want to be instituted, and you end up with a mess.
Yeah, I mean, you're I think pretty spot on. I think at least with the current case fatality rate of COVID, people just view, I think let's use 1.2%. That's the number I remember last as a hearing with respect to how many people die from COVID. We view that number as low, just numerically speaking, but when you look at the actual death toll right now, that's translated into a lot of deaths. I mean, we just crossed the 675,000 mark, and some scientists are even predicting that, by the time we get through next winter, we could eclipse 1 million if things don't get better. And, again, all those deaths are preventable. And I think if we had a much more robust understanding of the science and people were more willing to engage with it, I think we would have a much greater collective consciousness about how truly serious the virus is, even if numerically 1.2% is what it is. It still translates to, unfortunately, more deaths than we'd like to see. I mean, again, it just boggles my mind that we've gotten this far. It feels like we're not learning. We're not learning what we should. It's one thing to fall from grace and to make mistakes, but that's what troubles me, both on institutional and interpersonal levels. It feels like we're not learning lessons, and I think that's going to prolong this even more, and I think it's going to be a preview as to how we respond to both other pandemics in the future, and something I think even more existentially frightening is climate change. I think a lot of the responses involve that shared collective consciousness about there's this existential threat to our lives, and even if we don't have a situation like India where there were funeral pyres everywhere and people were basically forced to look at the corpses of their friends and their family, right? That's something that really like set home in the minds of the people of that country is, the less than stellar, I guess, developmental status of their healthcare system. It's just the fact that India has like 1.3 billion people. A lot of them live in abject poverty. That led to a lot of deaths. They had a peak of like 430,000 cases during their Delta surge, as the first country to have a Delta surge. So, again, in that respect, sometimes it takes bodies literally hitting the floor for people to really like have it set in that like, this is something that could hurt me. This is a very real, tangible threat to me, and I need to do something about it. Oh, hey, look, there's this awesome tool that could keep me alive. It's called the vaccine. I should go get it. Maybe we're a little bit spoiled in the West, and we have a good enough healthcare system to rescue enough people from that kind of fate to where everybody's not seeing people in their circles, their family, friend circles, just constantly dying. So I guess in that respect, I like to see human life being preserved, but I'm definitely not advocating for killing more people to drive it home to the rest of them. But at some point, like people need to realize that there were and still are refrigerated trucks to handle dead bodies, especially in the South right now, where their healthcare systems have objectively collapsed, where they're building triage facilities and parking garages at university medical centers. Mississippi comes to mind. When we're in that kind of a position, like that's another narrative that I think doesn't get talked about enough. We locked down before to prevent the healthcare system from collapsing, and we're living through the collapse right now. And it was teetering in the first place with respect to the lack of socialized medicine and access to the healthcare facilities that we have. But this is, the removal of the final Jenga block, and we're watching the entire tower come down. And people seem to be closing their eyes and ignoring that. And it's scary to me.
The refrigerated trucks were tough. All right, so if anyone wants to say anything, please hold on to it. There are two quick live chat things I want to hit, and there's one more topic I wanted to get to before the end, but not in a rush. But I want to make sure that we hit this. First of all, Sinister Porpoise, $2. A tech solution is imperfect. Unhackable equals false. In other words, a tech solution is still imperfect because it could be hacked. There are ways around it. The good news is, ostensibly, it's not like hacking a bank in as much as there's a lot of reason to hack a bank. If you can get the money, hey, great. If you can hack and get somebody so that they're on the system when they're not supposed to be, that's not. There's still people who are going to try to do it and make money off of it, but at least there's less incentive there, I would imagine, to really try to hack. We also had one other chat. I love this comment. I think this is a great comment, and I think it's an important comment, not for the reason that the commenter thinks. Gloria Miller said, the warning label on a box of surgical masks. This product is an ear loop mask. This product is not a respirator and will not provide protection against COVID-19 and other virus or contaminants. Yes, thank you. That is correct. Unfortunately, I'm bothered by the fact that the masks provide a little protection. It's a little. It's not enough that because it provides a little, then people miss the argument. You are not wearing the mask to protect yourself. The reason this is not an issue of freedom, the reason that this is not an issue of... The reason you need to wear the masks is to protect other people. If you've got it, the mask dramatically reduces your ability to transmit it to other people. If you cough into the mask, it dramatically reduces the amount of particles that go out, hang in the air, infect the people behind you, next to you. It is to protect other people. And in the same way that actually it turns out the government does regulate things like you kind of have to wear pants. You can't go into a McDonald's naked, believe it or not. You actually have to wear maybe shorts or a loincloth at a minimum. Now, that's
can you
mandated.
Tell Florida that?
Yeah, I kind of like to, because it's like you can't make me wear one more article of clothing because that's going to be fascism. We're going to be Germany circa 1940s if you make me wear one article of clothing. Why? Not for modesty. By the way, you can't wear a tank top in most restaurants. You can't wear a tank top near the salad bar. And there are actual reasons for this, and all of them pale in comparison to the reason somebody wants you to put a piece of cloth over your face. Honestly, in my view, and I don't ever say this for all the reasons Homozygote just mentioned, I can't sit there and say the easy thing and the thing that would make this conversation so much easier and would stop misinformation. If I misrepresented one thing, I'd stop so much misrepresentation. If I said those masks didn't protect you at all, that would stop so much misinformation, because then people would realize the reason to wear them is you protect other people. They protect you a little bit, just a touch, enough that you can't wear them to protect yourself. And that's why they say that on the mask. It's not to protect you. But because it protects you just a little bit, that's what people think the mask is about. That's 10% of at most. 10% of the reason to wear the mask is because it protects you. That is at most 10% of the reason. Every human being you know has turned into a potential weapon. This is because they could be infected with something that can kill you. That mask dramatically reduces their ability to infect you and other people. That's why you wear the masks. It has nothing to do with protecting yourself. Well, no, just enough that people love onto that, and that's not what it's about. Now, Xandring is probably going to have a lot of great points as to why that still doesn't necessarily empower the government, and he may be right, but it may not. The argument, nonetheless, every citizen has been turned into a potential weapon. The mask reduces the danger, and if I can force somebody to wear pants at a McDonald's to reduce like emotional psychic trauma, because I've seen the average American male, for whatever reason, I don't understand why saying you have to cover your face to prevent you from killing 700,000 Americans is a violation of somebody's fucking freedom. I don't get that, and I would honestly like to. You can come here. I will relinquish control of the mute button, and if you have the argument for that, come here and give it to me, because I would honestly like to hear it. So thank you very much for that. Did I interrupt? The only one remaining thing is, and the drug that what's her name requested, and has now there's two quack doctors. Thank you. I'll let him say it.
I'm very familiar with ivermectin because I own livestock.
Oh, you poor bastard!
Yes.
I'm sorry.
Oh. So, and I guess it has on occasion been prescribed to human beings. It's anti-parasite. Is that correct?
Yeah, it's an anti-parasite drug.
Okay, so between that and the doctor who now got fired, and I think they're talking about removing his medical license because he said you can die from carbon dioxide poisoning by wearing a mask. This was a medical doctor who said this, and I think he's had his license revoked. But nonetheless, so we've got a number of really bad things going around. But let's talk about that word that I can totally pronounce, but I'm going to give Xandring the credit and just let him say it. So she requested it. In fact, she was demanding it. Said the doctor's a little funny about giving it to me, which really pisses her off. It's like, oh my God, talk about a Karen. And she's gonna be a Karen about the thing no matter what the hell happens. But at any rate, what's this drug and why is it important?
Oh God! So I basically have been calling this on my streams the horse paste meta, because we've been having a culture war about basically the horse equivalent of anti-parasite toothpaste. It's wild to me. So this drug again is called ivermectin. It's a drug that its supporters will definitely tell you, kind of like the vegan in a room will tell you that they're vegan. An ivermectin stan, for lack of a better way to phrase it, they will tell you that this drug won a Nobel Prize, which it did, but it won a Nobel Prize for being really good at treating parasites because it's an anti-parasitic drug. That was the discovery that led to it winning a Nobel Prize. Now, how this even came about...
Let me interrupt real quick. How many people have gotten the parasitic variant of COVID?
0, because we're dealing with two different germs.
Well, no, but isn't a parasite the same thing as I mean, SARS or something like? I mean, you can use an anti-parasitic to treat that kind of infection, right?
Well, so when we say anti-parasite, we're actually kind of referring to like an entirely different microbial classification of organisms. So, generally under the umbrella of microbiology, you have bacteria, you have viruses, and you have parasites. So when I say ivermectin is an anti-parasitic drug, it's not meant to be an antiviral, like at all. It's not meant to be, it has no clinically approved indications for the treatment of any virus at any point. Never had one prior to the pandemic, and based on the available data, it should never have one, at least with respect to SARS-CoV-2, the virus that causes COVID-19. So again, like this was discovered as an anti-parasite drug, and it's very effective in doing that. It's been used in humans, especially in a country like Nigeria, for example. That's the the big case study that always comes up. But there's a parasite that causes river blindness, as it's called, and ivermectin is very good at ivermectin's very good at taking care of that. So it's a essential medication for treating parasites. Where it comes into the picture for COVID is basically sort of twofold. There are two people, I call them science chuds, as they were. One is a physician by the name of 𝐂𝐚𝐥𝐥-𝐈𝐧. He previously worked at the University of Wisconsin Medical Center in some capacity as like a ICU pulmonary critical care physician. He basically had a very large philosophical disagreement with just about every other physician and most scientists when he wanted to basically take the approach for COVID where we try and figure out if any existing drug is going to be helpful at all. Let's throw all the spaghetti at the wall and see if any of it sticks. That was basically his approach, and ivermectin is one of those spaghetti noodles that he wanted to throw at the wall, whereas everybody else around him was like, you know, we need evidence to do things like that first, especially if we're giving a drug to a person who's sick with something that we don't really understand right now. You know, we need knowledge, we need data, we need, ideally, you know, clinical trials that are randomized and controlled and have placebos and have all the proper, you know, bells and whistles to them before we start making those decisions, right? And over the course of the pandemic, we've had a couple of medications that have met some of those criteria. I think remdesivir barely made the criteria, and that's a whole separate conversation because I can pull out some science to say that it actually doesn't do a very good job of being an antiviral. But remdesivir is approved. Dexamethasone, that was approved in the UK. They ran clinical trials and they found that. And I think even another steroid, budesonide, as another now tool in the toolbox for physicians to try and treat hospitalized COVID patients. So, you know, there is a framework for how science and medicine goes about trying to figure out, you know, can we repurpose an already existing molecule or drug to try and treat a different disease or illness or what have you. 𝐂𝐚𝐥𝐿, of course, disagreed with all of that. He quit his job over it at the University of Wisconsin Medical Center. He got hired basically on a probationary basis at a different hospital. And ever since, he's now functionally become part of the intellectual dark web. So he's been making the rounds on Joe Rogan. He's been making the rounds on Brett Weinstein's podcast. And he's the other person we're going to talk about in just a second. He's been making the rounds online, basically pushing ivermectin as a miracle cure that's being suppressed by, you know, big pharma and big science that people need to be, you know, calling their politicians about and fighting like hell about at the hospital. 𝐂𝐚𝐥𝐿, in the spirit of this notion, he started a group of physicians who agree with him called the COVID-19 Frontline COVID-19 Critical Care Alliance. It's FLCCCA, which is a mouthful. This is a small group of doctors who function as ambulance chasing lawyers, but with MDs instead. What they do is they go literally stand outside of hospitals and try to offer the family of hospitalized and even ICU hospitalized COVID patients prescriptions for ivermectin. This actually resulted in a court ruling in the state of Ohio where a judge literally overruled the medical autonomy of the practicing physicians in a hospital because one of 𝐂𝐚𝐥𝐿 doctor chuds gave the wife of a dying COVID patient in the ICU an ivermectin prescription. A judge actually made the hospital give that man in the ICU ivermectin without any scientific data to back it up. Which it just boggles my mind. I think later that court ruling got reversed on some sort of appeal, but the fact that it even occurred in the first place, I think sets a very dangerous precedent that scientific misinformation can actively involve the judicial system to try and override the medical advice of groups of doctors at a time because some dude in a white coat standing outside the hospital with a prescription pad to, you know, give the pill form of horse paste to somebody for objectively no good reason. 𝐂𝐚𝐥𝐿, he has a website where he claims there's a mountain, a treasure trove, if you will, of data scientifically that support the use of ivermectin. However, epidemiologists, I think one in particular by the name of Gideon Meyerowitz-Katz, which again is another mouthful, but he's an epidemiologist out of Australia. He's taken to Twitter and taken on the monumental task of looking at the purported mountain of evidence, which comprises, you know, 60-something very poorly designed randomized controlled trials studying the use of ivermectin that have been carried out in various countries, low to middle income countries mainly, to see, is this evidence actually legitimate? Like, has all of the work that is being cited here been done properly? Does it have the proper controls? Things like that. And the overwhelming sentiment here is no. Most of it is probably fraudulent. And two of the largest scientific publications that supported the use of ivermectin for COVID were voluntarily retracted by the people who published them because it was discovered that they were making up patient data, cooking the books, fudging numbers, lying about just about everything that you could possibly conceivably lie about. And that, I think, is also fermented in the minds of people politically on the right, because they feel like they're buying into this big pharma is bad narrative and there's this cure, and they think that they have scientific evidence to back them up. When in reality, they have nothing but a body of fraudulent science to introduce that into their minds, and they're essentially being lied to and victimized. I think Pierre Corey is someone who genuinely believes that philosophically he's correct, but I think he's also kind of seeing the secondary advantage of what he's doing right now in garnering a lot of attention, a lot of notoriety, a lot of fame, and using a sort of ivermectin as a stepping stone to get to that place. That brings us to our second person who's been in lockstep with Pierre Corey, a PhD scientist, or I really struggle calling him a scientist. His name is Bret Weinstein. He is, and always has been, part of the intellectual dark web. He's most famous for the Evergreen College incident, where he and his wife, who are they're both PhDs in evolutionary biology, so not immunology, virology, and microbiology. They have no training in this area. They both quit at Evergreen University over
the Evergreen State. Yeah, the Evergreen State. That we actually covered the entire.
Yes.
Fox News was that the only action. And to be fair, that was an incident that should have been covered by mainstream media, and really did show bias, because it's like all the left wing media did not cover Evergreen State, and oh dear Lord, riots, protests, students locking. But anyways, please, we actually have that. We've covered the whole thing. If anybody wants to look into it, we have the thing on it. But please continue.
Yeah, no, I think that's totally fair to bring up, because that's one of their biggest arguments for why they've been exiled for academia, is when all of that happened. The left-wing media didn't really talk about it all that much, and I think a lot of that situation was their own doing too. They actively objected to measures on campus, and they deliberately created an unsafe situation that they voluntarily thrust themselves into to again try and attract attention and notoriety. I call it the Slip and Jimmy from Better Call Saul, the prequel to Breaking Bad, trying to pull a fast one pull the wool over people's eyes. I think they did an exceptionally good job at that, clearly, because they're still hanging around. So all that to say, in modern times, Bret Weinstein, again, he's been functionally exiled from academia, and for good reason. It took him 9 years to get his PhD, which is a travesty. Most people who get a PhD don't take 9 years. That either means you're an absolute black sheep of a human being, or literally everything you touch just turned to mush, and everything you did in science failed, which happens every now and again. But with Bret Weinstein, it's very much the former, considering his political alignments and his background. He, after that, of course, went to Evergreen, had that incident happen, and ever since then, his brother, Eric Weinstein, was the founder of the intellectual dark web, which has been host to some of the most malignant online personalities. Again, Bret, Joe Rogan, Sam Harris, and a laundry list of other folks who I think have sown a lot of the seeds of scientific misinformation. And now, in current times, we're watching them grow up into their, unfortunately, very ugly, very dangerous plants. So Bret Weinstein has been one of the leading ivermectin advocates. He's been really trying to emphasize the point that there's some big anti-science conspiracy where the opinions of scientists like him are being actively suppressed in the name of the pharmaceutical industry. He thinks that basically because he has a PhD, you should listen to him, and he has really abused the idea that people with credentials can be trusted more than people without, because that's really the foundation of why people listen to him. They see he has a PhD, and they wow, this scientist, this brave scientist, is really trying to spread the word about this thing. Maybe there's something to it. Maybe I should listen to him and go get it. Go to the animal livestock supply stores and buy out all the horse paste if I can't get a pill, and try to figure out how to dose it properly for my body weight, and try not to overdose on it, and try to use it as a COVID prophylactic drug. So it's come to a point in time where you basically have, I think, somebody like Bret Weinstein and, to an extent, Pierre Corey. They're both walking into a proverbial movie theater shouting that there's a fire, and that the only way out is to, hit themselves over the head with the fire extinguisher. So, to me, one, that doesn't put out the fire, right? Ivermectin, there's no good evidence that it actually is a prophylactic for COVID, so it doesn't prevent it, nor does it actually treat COVID. All of the randomized controlled trials that have been done properly show this. I think the one I really like to cite, the largest randomized controlled trial to date that's been completed for ivermectin out of Argentina, actually shows that the ivermectin group, in comparison to the control group, needed to go on a ventilator sooner, which means that ivermectin actually made them worse and not better. So, and there's also questions about whether or not
hydroxychloroquine as well, right? I mean, the veterans group, okay.
Yeah, absolutely.
It killed more.
Ivermectin is basically hydroxychloroquine 2.0. Like, hydroxychloroquine had cardiac issues, and its safety profile was known for a very long time because it's, again, used for a whole bunch of other stuff. Hydroxychloroquine literally has side effects that involve people's hearts. There's kind of a question right now as to ivermectin might have side effects. Go ahead.
Let me interrupt for one question. I'm at the Mayo Clinic right now, mayoclinic.org /drug supplements hydroxychloroquine. And this is an interesting one. Now, hydroxychloroquine, we also have talked about to some extent. It's a phenomenally dangerous drug. Sudden blindness, we had on a guest who had to take it for other reasons and were unable to now get it in the correct dosage they need. They had to get multiple pills, break the pills up to get the correct dosing, and they have to get an eye exam every 3 months. But among the side effects, drowsiness, dry mouth, increased thirst, loss of appetite, mood changes, no pulse or blood pressure. That's listed.
Yeah, I guess I was putting it very mildly.
Yeah, and I now they do that actually for a number of reasons. And if you check the box, that's on the box. The reason is people tend not to buy boxes, even if they need the box, even if they need what's inside the box. They don't always buy the box when it says, warning, ingesting the contents of this box could kill you. So what they like to say is no pulse or blood pressure. For those of you without an MD, that's code for you're dead. And that is a side effect of hydroxychloroquine. That is how dangerous this stuff is. And we covered the what the president had because there was a white paper that we covered right before the president got it. We covered, and we said this is working its way up into Washington. Hopefully it doesn't get into Trump's hands. It did, and he decided, and that whole paper was a fraud. But nonetheless, yeah, this is where we stand. So it's hydroxychloroquine. Please continue. You were talking about the side effects. I was like, Mayo Clinic, look it up. I'm not kidding. No pulse or blood pressure. That's the side effect. We still have a super chat I'll get to. I haven't forgotten it. I usually wait until I can fit them in well. So we'll get to it. So please continue.
Yeah. I really don't have too much longer. I think there's a similar potential, I think not to the same extent of actual death and asystole that hydroxychloroquine can inflict upon people who take it. But ivermectin is certainly not without its side effects. Liver failure, significant neurological toxicity, and a very unfortunate side effect of literally pooping out your intestinal lining, because ivermectin can actually cause you to shed your intestinal lining, which kind of makes some degree of sense if your intestines are filled with parasites. Maybe you're just kind of, throwing the baby parasites out with the bathwater. That is unfortunately a little too brown, but, you can kind of understand why that might be a thing that could happen. But that's actually been a very common, side effect, I guess, misinformation point in the anti-vax world, because they're used to having this happen with people who drink Miracle Mineral Solution, which is basically industrial bleach. That's been a long time anti-vax substitute is industrial bleach preparations, and it does the same thing. But when they see their intestinal lining come out, they're convinced it's working. They call it rope worms, which are not an actual medical entity. It's just intestinal lining happens to look worm-like. So the same thing can happen with ivermectin too. And a lot of people who unfortunately went right for the horse paste instead of a vaccine found that out the hard way. There are also questions about whether or not it could impact male fertility. There's a really well done study in mice that suggested that everything from testicular damage to sperm damage, sperm parameters like motility, shape, sperm count, testosterone levels are all negatively impacted in male mice that receive ivermectin. So to me, I think there's still a lot of study to be done about the impacts on male fertility for humans who need to consume ivermectin, ideally for a parasitic infection. So all of this to say, ivermectin is very understudied. It's a parasitic drug that is meant to kill parasites. It's not an antiviral. The body of evidence to suggest it's an antiviral is largely fraudulent. And the two people with credentials who have been pushing it, in my opinion, need to face A, professional, and B, ideally legal consequences for the ongoing tangible harm that they are doing to people.
All right, so we'll start to wrap this up. I definitely want to hear from Ms. Andring at least one more time, but I do want to. So, are you one of those conspiracy theorists that say, on top of, for example, you can't use an anti-parasitic to fight a virus? Are you one of those guys who says, on top of that, for example, you can't use like an antibiotic to fight the common cold, or that penicillin doesn't cure cancer? Is that really the stance that you're gonna take here? Is that roughly what you're saying?
I mean, look, if there's scientific evidence that something works, I go for it. Right? I base my takes off of scientific consensus. So if there's actual scientific evidence to suggest it works, then I'd be for it. But at this point, that does not exist. So I am against it.
Well, they're different classes, and I think it's important to. I mean, it's you can't put a bicycle chain into an automobile and expect it to run. They're different classes of vehicles. They're both vehicles, but they're not the same thing. And something that's designed to deal with a parasite is not designed to deal with a virus. And if it happens to work, it's highly unlikely for any number of reasons. But if it did, it would be just a long 1 in a billion shot. There's no evidence any of these work across the classes the way they're saying. So.
Yeah, every now and again, a molecule might have an additional application that we never knew before, like Viagra, for example. That was supposed to be a blood pressure medication, but then we found out it helped erections be sustained for longer. So that's actually a prominent example of something actually being repurposed when there is evidence. I think that's more empirical because people can see and feel that, but in this case, we're not dealing with that.
Well, that was that Simpsons thing where they give Homer a pill to suppress his diet. And then they sit him in front of all this beer and donuts, and they're just going right by, and he's just like, like, Homer, you don't want to eat the beer and donuts? Beer and donuts? What beer? I'm blind. And like, oh, okay. Well, we'll send that to marketing. They're going to repurpose whatever it is which is much closer to the truth than. All right. So, Andring, was there anything you wanted to say before we get going? And by the way, good to see you, Pat. Glad you're here. Snark, and we did miss actually super chat. Let me also hit the one super chat. It was aimed at you, was Read and Rap, and he wanted to know, I have a sneaking suspicion that this is an inside joke that I don't want to pass on, but $4.99 from Read and Rap. What do you think about the DEE's group?
No comment.
Yeah, I'm going to say no comment because I know exactly where that's going, but I think the one thing I've heard about them is that they do enjoy their peanuts.
All right, I have a feeling that this is one of those I'm going to feel like an idiot for afterwards, and it's way over my head anyway. So, is Andrew any last comments you wanted to get in, and we'll wrap it up? I know he needs to get going.
When it comes to people screaming "my freedom," they need to realize that state and local governments have been empowered to do quite a number of things, and public health is one of them. They've got generally have very broad latitude to institute public health policies to obviously promote the general public health. But on the federal level, the U.S. Constitution doesn't afford the federal government to create federal laws that cover the entire country with most public health policies. And it's a conversation because obviously, the founders had no idea about things like germs and bacteria, communicable diseases, etc. I mean, they knew that there were things that could kill you because obviously the Black Death wasn't that long ago. So, but they didn't know exactly where it came from. So, obviously, it couldn't have been included in the Constitution. But we need to have that conversation when it comes to things such as COVID, a pandemic, recognizing that giving states the autonomy to be able to decide how this is going to roll out or how this is going to work could be problematic, and that there may be an instance in which it would be appropriate for the federal government to institute rules and regulations to cover everybody else. I mean, we do this, in commerce, for example, the Interstate Commerce Clause. It's so that New York can't choke off all the rest of New England. They recognize that sometimes states could act in selfish ways that could harm other states. And so it would be within the purview of the federal government to intercede in that. So we need to have that discussion, and I think that we really do need to add an amendment that would allow, in cases such as a pandemic, federal legislation to be able to help control and protect from something such as a pandemic. But I think we actually need to have that conversation, and we need to have the actual amendment proposed and ratified to give the government that kind of power. You don't want to just do it willy-nilly or by fiat and say, okay, well, we're just going to let the government do this, even though they don't have the authority to do it. We'll just let them do it because, much like the continued authorization of the use of force and the Patriot Act, we find out very quickly that this stuff never goes away and can be used in many other instances that it was never intended to, and could end up causing quite a bit more harm down the road. So do it in the correct way. I think that we should do it. And hopefully they can pull their heads out of their asses and actually come up with a coherent and reasonable, at least scientifically reasonable, not just medically, but also economically, also personal well-being, a very holistic approach to minimizing the damage from not only this pandemic, but future pandemics.
Well, and I take it as I've never seen you reach an unconsidered decision, and to hear you suggest giving the federal government in any instance even a little more power is a bold statement. So, all right, thank you, Isandering and Homozygote. Anything that we skipped? Any last words you wanna say? This Reading Rap Guy, I just gotta say, twice. You are a guest in this house. You are a guest in this house. And twice you brought in somebody who I don't know what he's doing, but I get the distinct impression he's causing trouble. I'm just saying. He seems to be doing it well over my head, though, so there's nothing I can really do about it. He's the kind of guy we actually usually mod around here, but nonetheless.
He's a moderator, not only my Twitch, but just about everywhere that I see is that's actually dedicated to talking about facts. So he likes to throw a little mischief in the situation just to keep people honest.
Yeah, that's our head mod Titan. I think the two of them have just said hello to each other, so I'm now really a little scared.
There you go.
I don't need him joining forces. All right. Well, thank you very much for coming back on. I hope that this experience hasn't soured you, and you'd be willing to come back on again in a few more weeks, and especially if and when things take any significant changes. I appreciate you keeping our audience up to date and keeping me on my toes with it. So thank you very much. Tomorrow we have an overtime. We're going to be Joe is, and I forgot Joe is on vacation, so we'll have to see. We'll figure out what we're going to do with that. We may have another guest host. We'll figure something out. But and then Friday after dark, and we have a few interesting people. I'm hoping they're going to be able to join us for that. So thank you all for joining us. If you've made it this far, hopefully you liked the show. So please hit that like and subscribe button. It really does help us in the algorithm, the only God that we pray to here on In Time. So once again, thank you very much for joining us. Everybody, please do your best to stay safe and keep the others around you safe. This is an unprecedented time for all of us. Homozygote, once again, thank you very much for coming in and helping educate us and our viewers. Really appreciate it, Zandering. Great as always to see you. And we will catch you guys tomorrow. Have a good night all.